Why don't we go around the room and introduce ourselves if we could, and start with our director.
Mark Fairchild, Executive Director of the Commission on Improving the Status of Children.
State Representative Vanessa Summers, House District 99.
Dana Kenworthy, Board of Appeals.
Jennifer Dorfmeyer, DCS Director.
Eric Miller, FSSA Deputy Secretary.
Executive Director of the Indiana Public Defender Council.
Stacy Donato, Indiana State Senate District 18.
Brooke Huntington, Indiana Department of Education, on behalf of Katie Jenner.
I'm Jamie Smith, and I'm here for Dr. Weaver for the Indiana Department of Health.
Alenia Moore, Director of External Relations for DOC, on behalf of Terry Decker.
Emma Blackwell, Youth Representative.
Thank you. And I'm Dale Devon, District 5, State Representative, home of the Fighting Irish. So with that, we'll go ahead and get started. And we have an agenda and minutes. So we all had time to review the minutes. So if we have a motion to approve those minutes.
Second.
We have a motion and a second. All in favor, say aye.
Aye.
Opposed? All right. So next we do have our it's an exciting time, I guess, for the commission and the data that we can get a better overview of our kids count in our data. And so it's here to present our data. So, Indiana Youth Institute.
Thank you so much. I'm Ashley Haynes. I'm Vice President of Communications and Evaluation at Indiana Youth Institute. And I think this is either the third or the fourth time that I've had the privilege to come and share our State of the Child presentation and the data from our most recent 2026 Kids Count Data Book with you all. So I'm delighted to be here this morning. Just starting off a little background about Indiana Youth Institute. I know I've seen many of you either at the presentation that we've done at the State House or around the state. We also just finished touring around, we did 20 presentations in local communities across the state of Indiana, talking about state level trends and also talking about data that is specific to the counties where our youth serving organizations and communities live and support kids. So I'm delighted to bring state level data to you this morning. Indiana Youth Institute is a statewide intermediary organization. Our mission is to improve the lives of children by supporting the professionals and the youth serving organizations that work with kids. So we provide professional education, we provide data, training, resources to youth serving organizations and youth workers so that they can go out into the field and do the amazing work that they do with kids every day. Sure. So, I mean, we have on our staff, we've got a team of outreach managers that live and work all across the state, and they coordinate with local community partners like systems of care, like school districts, like Big Brothers, Big Sisters, to invite us into their community. We kind of move around from community, from county to county every year. So we're trying to get to as many counties as we can during the year, but it's a wide variety. And then it's open to anybody in the community to attend. So we've had folks from DCS, we have folks in the Department of Health, Department DOE, but also mentors from Big Brothers, Big Sisters, people from the school districts. Yeah, absolutely. So this morning, I am going to walk through the data that is in our 2026 Kids Count Data Book. And what makes this year's data particularly interesting and important is that we are now starting to see some data from the 2019-2020 time period. So when I was doing these data presentations in 2022, the most frequent question that I got was, well, what was the impact of the COVID pandemic? And at that time, and as you know, there is a delay in data. I don't have yesterday's data to present because that still has to be collected and it has to be rolled up and all of that. So at that time in 2022 and even 2023, my response to a lot of the folks was like, we just don't know yet. But this year, we are starting to be able to see information from that 2020, 2021 time period in comparison to how kids are doing more recently from 2024, 2025 data, and also what was going on with our youth pre-pandemic. So it's been a really interesting and exciting thing to be able to share in these data presentations this year. For the past 32 years, IYI has released the Indiana Kids Count Data Book as the statewide affiliate of the Annie E. Casey Foundation's Kid Count Network. We're one of 53 publications and network partners across the country. And we like to think about it more than just a collection of numbers or a collection of statistics. When we're talking about our kids count data and the information in the data book, we really think about it as a report card for adults. So it's telling us information about kids, but it's also really telling us how we are serving and supporting them, where we're doing a fantastic job and where there's opportunities to provide better support. So we're going to start with the big picture. Up here on the screen and in your packet, these are Indiana's overall child well-being rankings from the Annie Casey Foundation since 2021. You guys are the first group that I've had the privilege of sharing our 2026 rankings with. They just came out about a week ago from the Annie Casey Foundation. And we're kind of in a mixed picture in the middle. Indiana is ranked 29th nationally, according to Annie Casey for 2026 in overall child well-being. That is a decline from 25th last year. Indiana is continuing to perform strongly in education, where we rank 11th in the nation compared to other states. We rank 23rd in economic well-being, 25th in health, and 36th in family and community. And I'm going to go through data indicators that are related to each of those 4 categories. One of the things that's really interesting about this year's 2026 Kids Count ranking from Annie Casey Foundation is it is the first time that states receive a comprehensive score from 0 to 1,000 and not just a ranking. So you can see at the top here and in your packet where we have Indiana's overall score is 566. Overall ranking is 29th in the state. What's really interesting about thinking about the scores and the rankings, which I know it's a lot of numbers and it's a lot of comparisons here and there, is one of the other questions that I get when I do these presentations is, okay, so we're ranked 29th. What does that mean? Well, it's 29th in comparison to other states in the country. So if we're ranked 29th, that could mean other states, their youth outcomes got a lot worse, or it could mean other states got a lot better. The ranking is kind of just how we are in comparison to other states. But the new score that Annie Casey Foundation introduced this year is Indiana compared to Indiana. So over the next several years, as we get and understand the scores every year, we'll be able to both see how we rank as a state in comparison to other states, but also how we're doing in comparison to ourselves from the previous year, which is a really exciting nuance in the data to be able to talk about and to be able to share. So looking at, and I've included the state profile cards that Annie Casey released in the slides and also in your packets. You have them for reference. This is a little more updated information than what I was presenting this spring because this just came out a week ago. So I want to make sure that you guys had access to this information as well. So I'm going to start us off in the family and community data set. When we talk about family and community, it's one of the core domains by which we group our data, and we're looking at the structures that are surrounding children, who is caring for them, how stable those environments are, and whether young people interact with formal systems or not. Starting with Indiana's teen birth rate. Indiana's teen birth rate continues a long-term decline. In 2022, the teen birth rate for youth age 15 to 19 was 16.7 per 1,000, down from 17 per 1,000 births in 2021. That translates to 3,753 infants born to mothers aged 15 to 19 in 2022, compared to 3,845 in 2021 and 4,126 in 2020. So we're continuing to see a downward decline in the teen birth rate. Teen births accounted for 4.7% of total births in 2022 in Indiana, which is down from 5.3% in 2020. Over a longer horizon, the trend becomes even clearer. Looking at the graph that I have up here on the screen, in 2015, Indiana's teen birth rate was 22.3 per thousand births, and by 2022, it had declined to 16.7. That means more stability for families and improved economic mobility for teen parents. At the same time, the national rate, which is the gray line you see up here on the screen, was 13.5 per thousand, and Indiana ranked 14th highest among states. So while we are seeing continued sustained improvement and change, our teen birth rate in the state still remains above the national average. I'm going to share a lot of numbers with you. Many of them are in your packet. The rest of them are in our Kids Count data book and on our dashboard, which I'll talk about how to access those resources. And I've given Blaine also a couple of hard copies of data books if hard copy books are something that, like I, still use. Talking about our grandparent caregivers in the state. In 2023, 41.6% of Hoosier grandparents living with their children were responsible for their care. That's compared to 32% nationally. On the screen, the yellow bars are for Indiana grandparents, and the gray bars represent the United States. That rate declined from 42.2% during the 2028-2022 census period to 41.6% in the following period. Among grandparent caregivers, 56.1% of them are between the ages of 30 and 59. 43.9% were age 60 or older. Nearly 60% of our grandparent caregivers in the state are in the labor force, and their median household income was $68,000. At the same time, 28.3% of children in these households lived in renter-occupied housing. 42.6% received SSI, cash assistance, or SNAP. What this looks like in real life, day to day, is grandparents delaying retirement, juggling work and childcare, or stepping into full-time parenting roles unexpectedly. These grandparents are often the difference between a child entering a system or staying with their family. Moving into talking about some of our systems that our youth are involved in the state. Between 2022 and 2023, juvenile new admissions increased from 346 to 497, representing a 43.6% increase in 1 year. In 2024, the number declined slightly to 495 new admissions, suggesting a potential leveling off after a sharp increase the previous period. Looking at the population snapshot from January 2024, 63.6% of incarcerated juveniles were held for a level 1 felony, up from 58.8% the prior year. In January 2025, that share declined to 57%, indicating a shift in the composition of offenses after last year's spike. Gender distribution remains heavily male. In January 2024, 87% of incarcerated juveniles were male. By January 2025, males accounted for 84.8% of the population, still representing the overwhelming majority. The average age of intake remains relatively stable, right around and just above 16 years of age. From this, we can see that system involvement continues to concentrate among mid to late adolescents. So while overall admissions have stabilized and the share of level 1 violent offenses has decreased from its peak. When we shift from admissions to recidivism, the data becomes more complex. So there's a lot of detail about this in our data book as well, with in-depth explanations of all the findings here, additional data charts. There's also county level tables for each of these indicators that show all 92 counties, how they are in comparison to other counties and also year over year. No, you're fine. Yep, I'm going to talk about that right now. No, you're fine. You're fine. You're totally fine. Among juveniles released, and if I don't answer your question, please ask it again. If I don't know the answer, I will find out the definition for you. Among juveniles released in 2021, nearly 1 in 3, 32%, returned to incarceration, up from 25% reported the previous year. In addition, 57.1% of juveniles released in 2021 were charged with a new crime, up from 51.3%. Weapons were the highest offense category at 50%. Recidivism rates differ by gender, which I don't have on these slides, but it is in the data book. 35.1% of male juveniles returned to incarceration compared to 14.9% of females, consistent with prior year patterns. So almost a little over twice as many of our male juveniles are returning to incarceration compared to females. Felony level also matters. Juveniles classified as level 2 had 32.4% recidivism rate, aligning with the previous year's trends. Age at release continued to play a role. The younger the juveniles at the time of release, the more likely they were to return to incarceration. So while new admissions have leveled off slightly from their 2023 peak, recidivism indicators show upward movement in several categories, particularly among males and younger juveniles. Did I answer your question? Yeah.
DOC has the definition of 3 years without any new cases. So basically, it's the same for
Yeah.
Yeah. And then the law passes out.
That's okay.
And it almost pretty similar. And you're aware.
I don't know what the adult rate is. Yeah, you're welcome. Okay. And please feel free to pause me as we go along. We'll have plenty of time after for questions. And again, if I don't know the answer to your question, I will take it back to my data team and be able to follow up with you all. I'll say we're going to look at our health category next. If we think about family structure and system involvement shaping a child's environment, health data shows us how these environments translate into outcomes, beginning before birth and continuing into adolescence. Health spans from infancy through adolescence and reflects both access to care and the lived experience of our kids. We're going to start with some of our youngest. We're going to start with infant mortality. Infant mortality reflects not just what happens in the hospital delivery room, but the conditions surrounding a pregnancy: maternal health, access to prenatal care, housing stability, nutrition, and chronic stress. Here, Indiana is represented on the screen by the blue line across the past 10 years. United States is represented in the gray. Indiana's infant mortality rate has declined to 6.6 deaths per 1,000 live births in 2023, down from 7.2 in 2022. There were 523 infant deaths in 2023 compared to 564 the year before. For context, the national rate was 5.6 per 1,000 live births, meaning Indiana remains above the US average, even though we see a general steadiness and slight decline. Among Black infants in Indiana, the mortality rate was 13.8 per 1,000 live births compared to the average of 6.6 in the state. So while the direction is positive, disparities remain significant, and the gap between Indiana and the national average has remained persistent. Low birth weight is another early life indicator that carries long-term implications. In 2023, 8% of Indiana infants were born with a low birth weight, which translates to roughly every 1 in 12 babies. This rate has remained relatively steady in recent years. Low birth rate increases the likelihood of extended hospital stays, developmental delays, and chronic health conditions later in childhood. The fact that the rate has not increased is positive. However, the absence of meaningful decline suggests stability rather than a move towards improvement. Access to care begins with insurance coverage. Most Indiana children are insured, though the state still sits slightly above the national uninsured rate. In 2023, 94.6% of children had coverage, leaving 6.1% uninsured compared to 5.4% nationally. Children with disabilities had high coverage as well. 95.6% were insured, but most rely on public insurance, slightly more than the national average. Coverage stability is also strong. 90.4% of children had no gaps in coverage in the past year, just below the US rate. Affordability remains a challenge for some families. Nearly 28% of caregivers said their child's insurance did not fully meet their needs, and 17.7% had more than $1,000 of out-of-pocket costs. Overall, most Indiana children are insured, which is good news. That supports preventive care and early diagnosis, but insurance alone doesn't guarantee access, and that brings us to provider capacity. Insurance coverage is one piece of the puzzle. Provider availability and accessibility is another. Indiana's mental health provider ratio is approximately 440 patients to one mental health provider. Indiana's primary care physician ratio, and these ratios include kids and adults. They don't separate it out by age. Indiana's primary care physician ratio stands at roughly 1,510 patients to one primary care physician, and the dentist provider ratio is approximately 1,650 to 1. All three ratios improved from the previous year, yet they are still higher than the national averages. When these ratios improve, it means that more providers are available relative to population, which can shorten wait times and improve access. For families, this translates into wait lists for therapy, limited specialty options, or long drives for dental or pediatric care. Kids may have insurance, which is great, but timely opportunities to see their care providers remains a challenge. Mental health providers support children through assessment, therapy, crisis response, and treatment. Primary care providers often identify developmental or behavioral concerns early, and dental access remains essential for preventing more serious oral health issues later in life. So overall, the takeaway from our provider ratios is that we're seeing progress year to year, but there are still shortages compared to the national averages, and these also vary very deeply county to county.
Can I ask a quick
Yeah.
question? For mental health provider, is there a specific provider that you're looking at? Is that a licensed therapist or?
It doesn't include, it includes all of those.
Everything?
Yeah.
Okay.
Yeah, and it's interesting being out in communities talking about these ratios. I was in Floyd County, down near Louisville at the beginning of April, and they have pretty higher ratios than the state of Indiana. But it's also interesting to hear from them, being so close to Kentucky. Many of those families just drive, if they don't have access in their county, Indiana, a lot of them are driving across the state to Kentucky because, and I don't know what Kentucky's ratios are, but if families are figuring it out, unfortunately, just might not always be closest to where they're living.
Close to where they're living, or do they feel the services of it?
I don't know. It's a good question. I don't know. And I mean, in our rural communities, the ratios are obviously a lot higher than in our urban centers. It's probably a mixture of both, also depending on if it's a specialist or what a specialist versus a primary care doctor versus another type of service that you need. All right, we're going to talk about some of our older youth and mental health. According to the Indiana Youth Survey, in 2022, 35.7% of students reported feeling so sad or hopeless for 2 or more consecutive weeks that they stopped doing usual activities, which is the clinical definition of depression. In 2024, which is the most recent data year for the Indiana Youth Survey, that number declined to 29.9%. That nearly 6-point drop represents measurable improvement. Similarly, students who are seriously considering suicide declined from 17.2% to 13.9%, and students making suicide plans declined from 12.8% to 10.1%. These are meaningful shifts. They suggest that prevention efforts, school-based support systems, and increased awareness may be contributing to reported improvement in reported systems. However, we know that survey data is only one part of the picture. There's also youth-reported information, and we also know that it's likely underreported as well. However, it is the trend is on a downward decline, which is what we want for these mental health indicators. Now, while student-reported symptoms of sadness have declined, mortality data tell a more sobering part of the story. In 2023, 152 Indiana youth ages 10 to 24 died by suicide. Of that group, 65 were youth between the ages of 10 and 19. Suicide remains one of the top 3 causes of death for young people in Indiana and has held that position for more than a decade. As fewer students report persistent sadness or suicidal ideation in surveys, the most severe outcomes still remain elevated. The data suggests that while prevention and awareness efforts may be reaching many youth, there are still young people experiencing crisis at a level that results in tragic outcomes. So we're seeing an improvement in how students are reporting how they're feeling, yet suicide remains a leading cause of death for students in our state. Substance use trends tell a different story, one of long-term decline. Between 2022 and 2024, past month alcohol use declined from 10.9% to 9%. Cigarette use declined from 1.5% to from 1.9% to 1.5%. Vaping declined from 9.4% to 6.6%, and marijuana use declined from 6.4% to 5.2%. And these are not short-term 2-year period drops. They continue a decades-long decline. You can see the data on the screen and in your packet. We are going back here to 2018. All 3 categories here have shown a decline in each reporting period. However, overdose deaths among youth ages 5 to 19 did increase by 5%, and opioid-related deaths increased by 8%, reinforcing the remaining concerns. To my knowledge, this particular substance use question that the Indiana Youth Survey asked does not ask about opioids. So I don't have that data in comparison to this exact chart, but those have decreased while some of our other, perhaps more accessible substances, those are declining. Looking at our data related to economic well-being next, health outcomes are shaped by economic conditions like housing stability, food access, and financial security. We're going to start with children living in poverty. Data show that children living in poverty has reached one of the lowest points that we have had in the past decade. The progress shows compared to where we've been in the past, even though other signs of economic stress like food insecurity have gone up, we are seeing relatively low levels of poverty in the state. Food insecurity, however, saw one of the sharpest shifts. In 2021, 12.9% of Indiana children were food insecure. In 2022, that number rose to 18.2%. In total, 285,070 children were food insecure. Of those children, 30% were likely ineligible for federal nutrition programs, meaning their families earned too much to qualify for assistance, but still struggled to consistently afford food. Additionally, 31.1% of households reported that while they could afford enough food, it wasn't always nutritious, higher than the national rate of 27.4%. These increases are not subtle. They reflect a lot of the financial strain that our families are feeling. And I do want to share, because some of this food insecurity data in particular comes from a national data sources. 2022 is unfortunately the most recent data year that we currently have. So these numbers do not reflect some of the economic and financial hardships that our families may be experiencing right now in 2026.
Is there a way to know if these families have access to food pantries?
This potentially, if the census collects and cross-tabs that data. I'm not aware specifically, but I can ask and see if the census does cross-tab that information. Housing costs tell a different story, less about sudden changes and more about ongoing challenges. For homeowners, the share paying 30% or more of their income on a mortgage dipped slightly from 20.3% during the 2014-2018 time period to 19.5% in the 2019-2023 time period. For renters, though, that's a different picture. The percentage paying 30% or more of their income on housing costs barely changed from 47.5% to 47.4%. In other words, nearly half of renter households with children are still cost burdened. That tells us that rental costs remain a real ongoing strain, especially for families who don't have home equity to lean on. And stable doesn't necessarily mean affordable. Looking at our education data set, economic stability influences nearly every education outcome: attendance, concentration, performance, and persistence. So we're going to look at that data set last, and then I'll show you some of our resources, and then any questions that you might have or anything that I can take back and get from our team. The education data allows us to see how students are progressing from early literacy through high school completion and into post-secondary pathways. This chart compares the demographic composition of Indiana's teachers and student populations in 2025 by gender and race ethnicity. Overall, the teacher workforce is predominantly white at 81% and female at 57%. In contrast, the student population is more diverse. 62.5% of students are white and 48.9% are female, the slight majority male. This chart highlights a notable demographic gap between Indiana's largely white teaching workforce and increasingly diverse student population. Indiana's teacher retention rate declined from 87.1% to 81.6% in a single year, one of the sharpest year-over-year drops in recent cycles. An 81.6% retention rate means that nearly 1 in 5 educators did not return to their position in 2025. We know that stable staffing matters because it directly influences student performance, classroom culture, and long-term academic growth. Chronic absenteeism is one of the clearest signs a student may be at academic risk. It's defined as missing 10% or more of a school year, and it spiked during the pandemic. The education data is where we are really starting to be able to see some of those impacts, 2019 pre-COVID pandemic, the 2020-21 time period, and kind of where we are with the 2025 data. The good news is that chronic absenteeism dropped from 18.3% to 16.8%, marking the third straight year of improvement. It shows that we're moving in the right direction, but rates are still higher than they were before the pandemic. You can see when the absenteeism rate was measured in 2020, it was at 10.6%. Prior to that, 2019, it was 11.2%. So we're moving in the right direction from the high in 2022 when we were at just over 21%. Attendance has been recovering slowly. Students are back in classrooms, but consistent attendance habits have not fully returned to what they used to be. And this matters because attendance is closely tied to reading skills, math growth, and graduation. So yes, we're seeing progress, just not yet a full return to normal. Third grade reading proficiency continues to improve. iRead measures whether students are reading proficient by the end of third grade, a key milestone strongly associated with long-term academic success. Compared to the previous year, proficiency rates increased, signaling a continued recovery in foundational literacy. Indiana's iRead 3 proficiency rates rose from 87.3% in 2025, up from 82.5% the previous year. That nearly 5-point increase returns the state fully to pre-pandemic levels and matches 2019 highs. While scores remain slightly below some of the pre-pandemic benchmarks, the upward movement reflects steady academic rebuilding. In practical terms, more third graders are meeting proficiency standards today than in the immediate post-pandemic years. And reading proficiency at this stage predicts performance across all subjects and later grades, which makes this upward trend particularly important. iLearn scores in both English, language arts, and math also continue to trend upward. 40.6% of students were proficient in ELA, staying fairly steady from last year. In math, 42.1% of students were proficient, a modest improvement from the year before. And you can see in the chart in your packet and on the screen, 2019 proficiency rates were our recent highs. In 2020, there was no testing, and you kind of see where that, how far that dropped from the pre-pandemic to 2021, and then kind of in both subjects, language arts got a little bit more up and down, but generally slight trend upwards. After the learning disruptions during the pandemic, academic performance has been gradually improving. And since math recovery has lagged behind reading in many states, the upward movement in iLearn math scores is especially encouraging. Although proficiency levels have not fully returned to where they were pre-pandemic, the overall trend is positive. Academic recovery is still in progress and moving in the right direction. The SAT provides insight into college readiness and post-secondary preparation. Participation and performance trends help contextualize enrollment patterns. SAT outcomes reflect both academic mastery and student participation in post-secondary pathways. In 2025, 54.5% of students met SAT benchmarks in evidence-based reading and writing. On the screen, the EBRW is evidence-based reading and writing. A substantial increase from 38.8% the prior year, which is a strong gain. But only 25.4% met the math SAT benchmark. In other words, roughly 1 in 4 of our high school students are meeting college readiness expectations in math. So academic progress is happening, but it's happening unevenly. We're seeing literacy strengthening and math remaining an area of concern. Looking at Indiana's graduation rate, we have reached a historic high. If you're looking at it on the screen in the room, it's so high that it's blocked by our little info box up there at the top. Indiana's high school graduation rate increased from 91.8% up from 89% the year before. That means more students are staying on track and earning diplomas on time. This represents continued strengthening of high school completion. Graduation rates reflect not just academic achievement, but persistence, engagement, and successful navigation of graduation requirements. More students are completing high school than at any other point in our state's history. At the same time, the dropout rate has declined from 5.8% in 2024 to 4.8% in 2025. That 1 percentage point decrease reinforces the upward movement in graduation. Dropout rates remain lower than pre-pandemic levels, indicating stronger student persistence. And when dropout rates decline and graduation rates rise simultaneously, it signals improved retention across high school years.
How do you define dropout here?
Oh, that is a good question that I don't know the answer to, but I know that it is in our data book. And so let's actually... really nice about our data book, like I said, I've got a couple of copies that I brought here, and I'm happy to get more, is each page has, some of them are very tiny because we've got a lot of counties in the state. We've got county tables that break down all 92 counties, and then there's also definition and additional data highlights for each. So dropout rate is the cumulative number of individuals between the ages of 16 and 24, statewide and in individual counties, who are not in school and have not earned a high school diploma or diploma equivalent.
Is anyone tracking withdrawal to homeschool and whether or not children complete homeschool?
I don't know. Do you know if the DOE, if they're tracking it, we would be able to get the data, but I'm not aware.
It's not. Calls where they're going, often we.
Okay, thank you.
Yeah.
Actually, also, when you look at, the numbers for graduation are good. When I look, how do you relate where the absentee rate is 16.8%, but yeah, we're still graduating, 9. So it just seems, the numbers just seem a little.
Yeah. That's a great question. I don't know the answer to that either. Yeah, that's one of the really amazing things about getting to go out into communities, and we're looking at county level data. We've got a lot of the people in the room that are working with kids that can give additional insight, because I can share the numbers with you, but I can't necessarily talk to what's happening on the ground in the schools. But they're moving in the right direction, which is what we want.
You speak in the.
Oh, sorry. I hate mics. We are tighter in our definitions around chronic absenteeism, and schools have gotten tighter in their definition and when they count. And so that's part of what you'll see there. The two between, graduation and chronic absenteeism, there's some relationship in that we do see higher rates of absenteeism in high school over lower grade levels, which isn't too hard to follow. But those two aren't that closely tied at that graduation level.
How many days does a student need to be absent to make count in that percentage?
It depends on the district. So district makes some definition in that. 20, I believe it's 20 days that is chronic. But I can.
Yeah, the definition is like 10%. So depending on how many days the school year is.
So 180 days, 18 days.
We had some good conversation at the county presentations as well about graduation in particular, and I'm going to talk about college enrollment next with the new graduation requirements that are going to be rolling out. One of the big questions for particularly youth workers and youth serving organizations is how can they support how can they understand the new requirements, and then what can they do to support the kids that come to their after school program or their mentoring program or whatnot to help those kids and their families navigate as well. So they're already thinking ahead and looking to how they can support the schools and students in that way too. Post-secondary enrollment remains relatively steady. So we just talked about a lot of positive movement in K-12. Post-secondary enrollment has been relatively steady. For the class of 2023, 51.7% enrolled in college compared to 52.8% the previous year. That near flat, slight decrease trend suggests that while high school completion is improving, post-secondary enrollment has not accelerated at the same pace. Enrollment remains below pre-pandemic highs, indicating that the transition beyond high school continues to stabilize rather than expand. Graduation gains were clear. Post-secondary enrollment, a little bit more of a mixed story. The bigger story is that this year, Indiana is doing a better job of getting students to graduation. The next challenge is making sure that their diploma opens doors and that students have clear supported pathways into college, credentials, apprenticeships, or careers. So I'm just going to share just a couple things that has going on with IYI, and then just a couple of data resources for you. So I talked about these presentations. Oh, sorry, go
I
ahead.
just had a quick question on the last slide. Does that also count for technical schools? Do we have?
The college enrollment is 2- and 4-year schools. Yeah. The question that I get here in community as well is, what about students that go straight into something like becoming a plumber or an electrician or something like that? And if there's somebody that was consistently tracking and reporting all that data, I'd love to be able to share it, because I get that particular question almost every time that I do these presentations. But unfortunately, it's not tracked as well as some of our traditional education indicators.
It would be interesting to see workforce preparedness rather than just college. So
thank you.
And
I'm really interested with when the new diploma is fully implemented to understand what pathways kids are taking, how that then compares to what they do after high school and in the future. I'm really interested in seeing how that all connects once we start getting that data in. So I talked about the State of the Child, our data book, as our report card for adults. And it's kind of how kids have been doing, kind of more of a little of a look back in the past of how our kids have been doing, where we've been supporting them well, where we can strengthen our support. We announced at the end of last year a new statewide vision for that IYI wants to lead for the state. We're calling it 5 by 50. And the vision is that by the year 2050, we aim for every Indiana child to have a network of at least 5 caring adults in their corner. Research and lived experience show that consistent, trusted relationships strengthen mental health, improve academic outcomes, and foster a strong sense of purpose. 5 by 50 is both a goal and an invitation. It calls on all of us to help build the social infrastructure that every child needs. Some of a youth's 5 will be an elementary school teacher. It might be a 4-H instructor, a youth pastor, a director at a local boys and girls club. Others will be volunteers like a theater director, a guitar teacher, a mentor, and hopefully every kid has a family member, whether that's a parent, a grandparent, aunt, or uncle, also as part of their network of support. So we've been talking about this in communities as well. We're at the very beginning of it. It's our longest long-term vision that we've set as an organization. 2050 seems very far away and at the same time approaching very quickly. But currently we're working on ways that youth-serving organizations can activate it at the local level and connect and really understand how the kids that are in their program can be connected to kids in other programs and where they need support, so we can make sure that regardless of a child's situation, that they have at least 5 caring, supportive adults in their corner. So accessing some of these data resources, they're all available on IYI.com. We've got a data menu dropdown that's got the resources that I talked about. And one of those that I'm not going to show on the screen today, we have a digital county dashboard that's interactive. You can filter by county, so you can compare year over year for particular counties. As someone who still really likes paper and printing off hard copies of things, you can print off a version of the dashboard as well to take a county look. That's something that is helpful to take with you to a meeting if you don't have it pulled up on your screen. And then, like I said, the data book is also available on our website. And I think that is my last slide. So if there are any questions, happy to answer those or jot them down and take them back to my team. Wonderful. Thank you. You guys are always a wonderful audience. And I enjoy coming here every summer. Thank you.
Let's try that again. Oh. All right, next, we have a legislative engagement preparation discussion. So, Mark.
All right. Remember, we got a short break on legislative discussion. Now we're back already. And yes, it is June and we're talking about it. So my apologies in advance for that, but we know we like to prep ahead. We also know come August, we're already be looking at things that need to get drafted, looked at a little bit harder, where the interim committees are moving. So I promise this will be a quicker, less painful one than some of the ones we have during session. But a few items I do want to talk about. So I've got a few points for you. Talking about our visitation for youth in secure detention, some stuff going on with GAL and CASA funding, and we'll have a more important discussion on the extension revision to the CISC legislation in code. So quickly, we introduced last year, and this came through the commission, a bill that would put a baseline down for visitation rights for youth in secure detention. That was Senate Bill 111. Best number I've ever gotten on a bill. So unfortunately, I know it was an easy one to market and remember and everything. But unfortunately, last session was short and quick, and it was a new topic for them. So it simply didn't get the attention to get a hearing. Not that there was any discourse about it being bad or not a good fit or anything else. It simply was a very tight session going through that. So we are looking at if we want to reintroduce that in the coming session. And again, this sets a very basic baseline as far as what the rights are of visitation. So taking the concept that you can't punish away visitation, you have to have written documentation. If there's a reason that visitation is simply not a safe thing to do, that you have alternatives via phone and video conferencing, et cetera, in those rare instances. And of course, that you have all the ability to add as a secure facility more ability for visitation as they've earned those additional privileges into that. What we basically see is a youth that's disconnected from their family or as threat of being disconnected from their family regularly does not result in better behavior, almost always worse behavior. I can say my early days working in residential facilities, I saw this firsthand plenty of times, where a lot of times acting out would happen right when the visit was about to happen, actually, because the youth were very nervous about would their parent be showing up, would their loved one even be there, would it be a good visit, would it be a bad visit, and then sometimes the staff of that facility would say, well, I guess we need to cancel the visit, which would result in many worse things. Right. So we're just trying to look at that narrative a little bit more appropriately for what it is, for where the brain development of those youngsters are, and make sure that we have that dedicated baseline that you're not going to be disconnected from your family. We also recognize a lot of them don't have the privilege of having family that are visiting. So those that do, that's a privilege we want to make sure we remain intact. And can build towards that. So I don't think we were looking at making any edits or changes to this particular piece of legislation if it gets reintroduced. So pretty much the discussion we've had before, we'd be introducing this at our next meeting as part of our legislative priority package to say, do we want to go ahead with it? Do we want to go ahead and shop for sponsors and authors on the bill? Once again, moving into that. Any questions on that item? I think the biggest part of that won't be getting started much earlier and building the dialogue and building the stakeholder network sooner, since we'll have a better on-ramp for being able to do that well. We have, I think, a lot of support behind it, and the association that's helps with managing all the facilities and everything has been on board and endorsed it. So we have all the right players. It's, I think, an organization issue. All right. Another topic that came up as we watch as they start forming the interim committees. There was one specific one I'll pull out. I don't think we've given a lot of attention lately in this body on Gail Casa, so the guardian ad litem and court-appointed special advocate programs, often used in the same sentence, even though a little bit different. Casa is generally speaking volunteer-based. Guardian ad litems are generally speaking paid professionals, often attorneys, that work with the courts on that, but both have the role of being the eyes and ears and representative for the child and the best interest of the child in those court settings. So this got assigned to the Interim Committee on Fiscal Policy to look at how we can stabilize and have equitable funding for those programs statewide. Every county has some version of one and or the other. Some have both, some have one, and they get utilized differently in different situations. But looking at equitable funding and implementation has been a big part of it, especially since there's a certain pool of funding at the federal level that has been pulled back. So there's been a serious reduction. So for those counties that rely specifically on the Victim of Crimes Act funding, known as VOCA funding, there have been reductions, and that could be very detrimental to some of those. So in the interim, the Fiscal Policy Committee, along with about 6 or 7 other topics they're discussing, will have this one on their list. So right now I can say the Office of Court Services, which is the group where the Gail Casa State Office is held, is engaged in this and looking to offer support and resources there. But it's one we'll definitely be watching closely. If it turns into legislation or a fiscal ask going into next session, I'll probably be back saying, do we want to put some of our weight behind that to make sure those programs are stable and appropriately funded? So heads up for now, but I think one that we definitely want to watch closely.
I want to underscore this one because in our child welfare cases, courts are required to provide representation, and CASA guardian ad litems are way cheaper than appointing counsel. We also have the added complex nature of the attorney shortage on top of this. And so when you have wonderful CASA organizations whose funding is being cut by 40%, I think this could be a critical concern within the child welfare caseload. So I would encourage this group to watch this carefully, and to the extent we can agree on supporting a way to backfill that shortfall, I think we really need to do that here.
Thank you.
Do we know if the members on this task force have been chosen and who?
We haven't seen a membership list yet. I know that's active process right now at the General Assembly, so we'll look at that going in, especially looking at who they might be bringing in as some of the lay membership and others. So as soon as we have that and we have kind of that outreach list, I think that's something we can circulate through and make sure that we're all apprised to that.
I would just hope to be able to at least get the task force information that might help support things like that.
Absolutely. Absolutely. As we know with the interim committees too, they get a lot of topics and a lot of tasks. And it's very difficult for them to give all the attention to all the very important topics there are. So I think I'm here in agreement that if we can elevate that discussion, that we want to be there for part of that. And of course, looking at quality of our GAL and CASA programs. Quality comes with equitable funding and reasonable funding to make sure they get the training and supports they need as well. So I know we all want our representation for our youth in care to be the highest quality possible.
We should know that.
Yeah. So we'll make sure that gets circulated because that'll probably be out before the next commission meeting. My guess is if by our August meeting, I could be optimistic and say that maybe this interim committee has met and has its findings. That's usually a little early. But at least at that point, if we have membership, we can come back and discuss some of the outreach and ways that we can get involved, make sure they have the right data, et cetera. Great. All right. So it is that time again to talk about our legislation. So I will not be reading it verbatim going through because over my last 4 years of being here with the commission, I keep making it longer. So we'll discuss that a little bit though. One item that I've been asked to pull out a couple of times really in the past for when it'd be appropriate though is one of our definition pieces. And that definition has been, we have a very specific that only exists in code under the Children's Commission definition called vulnerable youth. And this says the vulnerable youth is someone who has been served by DCS, FSSA, Department of Correction, or a juvenile probation department, which is actually a fairly broad list when you consider the reach of groups like FSSA. That's a lot of programming that falls under that. And served by doesn't have any specific criteria under that either, so that can be a very short amount of time, et cetera. So that's a definition we've had really since the start of the commission. But there has been some discussion, and we'll get into that a little bit, saying is vulnerable youth a definition that we really love, especially using words like vulnerable, describing some of the very strong youth that we work with and support on a regular basis. I'll point out a couple places where that's utilized, just so you can see where it's at. And again, I've not found this anywhere else in code. It is a Children's Commission definition solely. So it talks about our two members of the commission that we have with us today, that they have to have been classified as a vulnerable youth for a certain period of time in order to be eligible for service on the commission. So they'd have to be served by one of those systems for a set amount of time in order to serve. That's one place where it's listed there. But it's also listed in a lot of areas of our duties of the commission. So when it looks at all the things we're supposed to study and evaluate, access to services for vulnerable youth, availability of services to vulnerable youth, duplication of services for vulnerable youth, funding services for vulnerable youth, and barriers to service for vulnerable youth. Also communication and cooperation with vulnerable youth and agencies connecting with them. And you can see the list kind of goes on there. So there's definitely, I think, a point of discussion saying, one, we've done a lot of work in prevention and early outreach and early intervention. So when we use the term vulnerable youth as we define it earlier here, we're saying it's really only the ones that are actively in service of those state systems. So is that accurate at that point? And again, a lot of these sentences to me look like they could be ended by taking out the word vulnerable and just saying youth. So that's me editorializing a little bit, so I'll leave it there for any discussion.
I personally do not think vulnerable youth is a great word to use for our people that we serve. I think this sounds like a good opportunity to assign to the Voices Committee. So the folks on there can help come up with the terms that would support our young people that have been affected by our systems. So a motion to assign to the Voices Committee.
Motion in a second. Any discussion?
Personally, I was thinking vulnerable, that we could come up with a better name.
That's
Yeah.
goal.
I guess I understand the wanting to get over the point of vulnerable, but we want them to move out of vulnerable to another step. So maybe we can find a better name. I agree with you.
Yeah. So, so it sounds like we're going to assign that to our Voices Committee, which makes sense. That's where our lived experience folks and families and youth and caregivers reside. So I think we've always said that what people define themselves is a good standard to work with. So what we can do is we can draft some definitions, maybe some alternatives and some options, bring that back at the next meeting as we look at crafting legislation for shoring that up. Great.
Any more discussion? Seeing none, all in favor?
Aye.
Opposed?
Great. All right. We'll look at bringing that back to you by the next meeting and see what we can get down for a piece of legislation, making those changes. Yes, making new definitions is always a lot of fun. So been there a few times. So just going through some of the other things that we have that are already in there. I don't have a lot of other proposed changes or areas there. So you can see our general charge of reviewing and making recommendations specific to legislation, providing information. Of course, we had a bunch of that here today, looking at best practices, policies, and programs. So that's our general charge of other things that we do. That first chunk was more about who we're aiming our work towards with some of that language there. Of course, all the entities that would cooperate both within state government and outside of state government Pretty comprehensive list there, and we use a lot of general terminology like stakeholders and organizations and such there. This is a place where we can always look and say, is there something more specific that we want to add? I think you've all heard my tirade on lists and what happens when we start adding things to lists, but I think we have a good comprehensive set going into that. A few things that I want to make sure that we do look at, because when we last did some changes to our legislation, we've added a few things and we've had some growth areas. So one has been with the Youth Justice Oversight Committee, which originally was created in legislation that kind of spun it off as a separate entity. It created a report, it put out some information, and then was awarded some work with some very large scale grants that they partner with the Criminal Justice Institute on. Now that group's being folded back into the Children's Commission as a committee with its own different sub-work groups and other entities under it still, as we look at continuing that work. So we've gotten some initial things out there, but we know support specific to youth justice still very warranted. Of course, we got our legislation a couple of years ago to create and provide staff support to our Youth, Family, and Caregiver Engagement Initiative. We've had a couple of early reports on that, and we actually just had our first major presentation to the Juvenile and Family Court judges a couple of weeks ago. So that was very strong and well received. So we're starting to really cycle out where we're pushing out the best practices and getting that there. Again, that was created in legislation that initially had a fiscal ask attached to it too. That was 2025. And for those of us that remember the fiscal of 2025, it was not an easy year for much of anything. So we were happy to leave that one without having any reductions to our budget, but we didn't have the gain that we wanted in order to really get that and some of the YJOC work a little further along going into that. And of course, we have all of our usual reporting and everything else we have to do. We've added in a couple of new task forces since we last talked too. Of course, we have our Voices Committee that's part of that initiative, the Child Welfare Task Force that we're partnering with that's meeting later on today, and our Suicide Prevention, Bullying, and Online Safety Group that continues to grow as the state attention on those issues continues to grow as well. So certainly no shortage of things there. And then, of course, last session, we were asked if we could take on the role of managing the Kids First Trust Fund board on top of that. So this is a good place to pause and say, are we wanting to advocate again with a budget year coming up, the need for an increase in our funding and what that could look like? We can have some discussion on that now if anybody's wanting to jump in. Our last request was an increase of our standing budget of $350,000 to go up to $440,000. If I were to propose again, I would say that is still very appropriate. That would allow us to convert our contractual staff into a full-time staff, brings in some additional trainings, bring back the ability to have paid interns, and make sure that Representative Summers can have her coffee and meetings. In reverse order of importance.
Any discussion or concerns, recommendations?
Ask for more money.
Big Mark's proposal with so I think so too.
We can always ask, right?
Yes.
So,
Absolutely.
and I know.
And Dale represents if I also get.
Oh, that's great.
It's a budget year, right? So if revenues are up, same time when we look at down with our gas tax, we have replenished that because everybody knows our roads aren't the best. And so we're taking away $5 million a day right now in our gas tax. So we'll have to come back. They're talking about backfilling that too with some of our surpluses. So it's going to be an interesting budget year.
Yeah. Yeah, and I think we've done a lot of good work. And again, most of the stuff on this last slide here is stuff that we've added just in the last couple of years as we've expanded and shown what we can do with what we have available. I can say we're definitely stretching every penny we can most days. And we're trying to be very good stewards to that. But there's a lot of stuff we're kind of holding at bay that I think we could be doing much more with just a little bit of a tipping point in the funding there. Not asking for anything crazy like doubling our funding stream or anything, but I know we took on these ones understanding the funding was tight. And the discussion with the General Assembly was we're going to do everything we can with what we have. We understand funding is tight, but you might see us back in a couple of years.
Mark, could we could it be possible then to get like a job description or something done for, the staff? Just so we have a better understanding of the role.
Yeah, absolutely. I think last time we were looking at it, we kind of did a bit of a breakdown on a time study of each staff and what they were putting in and how many hours that looks like. So we can put together a bit of a package like that again.
Just help us sell it.
Yeah, absolutely. And we'll also have, and you have last year's annual report up front of you. We'll have a new annual report coming out soon that again can talk about all the activities and places we're engaged in. I know there has been a lot of talk over the last few years about commissions and what they do, what they don't do, how good they are at reporting and telling their story. We try to be at the top of that list so we can really show what we're doing and how we're a part of some of those broader solutions. So absolutely, I think we can look again that together.
Need a motion.
If we want to look at adding a budget request, what I can do is I can build that into, if we're going to have legislation related to the vulnerable youth language and all of that, we can maybe, I draft the language up and bring it back next meeting. And then last on this list, but certainly not the least important, the commission is set in code to expire like all good commissions are. So our expiration date is January 1 of 2029. Now, yes, we usually choose to bump that out a little bit. I can leave that for a little discussion that I'm going to be hopeful about, that we would like to once again ask for an extension of that. It's usually they do either 5 or 10 years on those extensions is what I see most commonly. Any thoughts on if we want to continue existing past then? Because that really does need to be in any legislation we introduce this year. January 1st of 2029 is a really tight time frame, even though it looks like on the calendar that's a ways off. That'll be here very soon.
And that the budget for the commission goes through the Supreme Court, not through the General Assembly's general budgets, just so you know.
All right. So I'll look at getting some pieces drafted up for us at the next meeting, and we can look at how we want to package that. Some of that might be standalone when we look at budget requests and things like that, but we can have that discussion at the next one. So just want to prime everybody's pumps.
Question on the Kids First Trust.
Yes.
That funding
It's really earmarked for child abuse prevention work specifically. And also the language they have passed, there'll be some ongoing clarification about with that. We're taking on the role of the board. Where the fund itself is held is currently under DCS, and there can be some discussion about, what's appropriate ongoing in future with that. But child abuse prevention activities is what that is earmarked for. Yes.
So no administrative.
Yeah. And it's a pretty tight fund too, because they keep on making more and more of those specialty license plates. So we'll all be marketing that. I'll be checking everybody's license plate after the meeting, make sure you all have the Kids First Trust Fund one. For the record, I've had mine since they created them, so I got multiple in my family. So we'll pull that around. But I think that there's something where if we were to grow that, we would see it in administrative expense. There is a pocket available for that in it. But it's a fund that right now is just at the point of being able to replenish itself with its expenditures. So that wouldn't be a lot.
No, that same line we've been working with the child advocacy centers. Yeah, a lot of their funding has been reduced. They do a lot of prevention work. So, those are things that we're still trying to kind of get across the finish line now.
Yeah. The biggest part of the funding, I can say they work very closely with Prevent Child Abuse Indiana under the Villages, who has a great local outreach, especially when it comes to prevention education. They're doing some good work on water safety and some of the very initiatives that we've talked about here, where we see some of those child fatalities that were very preventable. So a lot of good work kind of already in the cycle there. And we'll have them, I'm sure, as it gets closer to that July 1st, 2027 date, come and talk a little bit more about this relationship as we build it on. Great. So that's why, do we have any other items though for our watch list of legislative items that we want to get ahead of? I know you've all got some, but.
Look, right now, I'm too cold to care. I need you to let me out of here.
So I hear remote air conditioner controls for commission meetings or personalized heating devices. Well, either way on that. Well, that did the funding request. Okay. But as these things continue to go through and emerge, definitely be thinking about for our next meeting where we like to really talk through some of the topics that make sense. I know it's always tough. There's 1,000 things we could attach to, and we've got to pick those ones where we really see a unique role for the commission where we can elevate and encourage and build something out a little bit more. If that's the end of that, we can move on to the executive director report, permission of the chair. So I've got a few items to cover there as well. And it looks like we're running ahead of schedule. So everybody's so sad about that, right? So a couple items that we've touched on over the last couple meetings, though, that I just wanted to circle back around to. One big one that we mentioned briefly at the last meeting that's kind of taken off a little bit is looking at the safe baby courts. This is something that was legislatively created a couple of sessions back. Representative Lauer was a large champion of getting that put forward. The idea of being that we would have some problem-solving courts that would specialize in 0 to 3 children. That's a very brief summary, but the crux of it is that it puts that young child at the center of the case and what we're doing with the case and make sure they have the services and supports they need. And also that we keep them in mind when we're looking at the timelines and how we support and move through that DCS process. So that's something that upon passage, I think there was a little bit of work to be done as far as how it would best fit and how to best get it off the ground. So I know the Supreme Court's been working on that for a while. DCS has been working on that for a while, but we were asked to come in and see if we could do any help on some of the modeling there. So still some work to be done, but I can say we are looking at, instead of keeping it under the certified problem-solving court model, which is very specific, and also something that a lot of counties already have and have practices related to that, we're looking at a conversion of it into more of an overlay that can come into existing courts. That would be existing problem-solving courts, so think our family recovery courts and things like that, or small counties that realistically, when they're looking at 0 to 3 cases and they might only get 5 to 10 of them in a year, standing up a court specifically for safe babies doesn't really have a very good likelihood of success, not to mention when we look at funding and everything else. So converting that model a little bit, and then moving it over to where the support from the Supreme Court will come through our Family and Children's Division of the Office of Court Services. They work with CHIMS, they work with Gail Casa, they work in that space a little bit more. So just a little reinvention. Nothing against all the groups that got assigned to it in the first place. I think it just got perhaps a little bit mislabeled as a problem-solving court under the certification model to put some limiters on it that really weren't intended by the legislative request. So a lot more to be done on that and what that model is going to look like. The good thing is several states have been doing this for a very long time. We have a lot of models out there, Florida, Tennessee, and many, many others that have done it in a lot of different ways. But just in making some of those tweaks, we've got a lot of interest. So it looks like we have at least 5 or 6 good solid courts that can likely be part of piloting what it will look like in Indiana. We actually had to slow down a little bit, and with the amount of courts we had interested, say, okay, well, we need to start getting picky and say, let's get the model right before we go further with that. So not a place to announce who's going to be part of that pilot or anything just yet, but to know that the interest is high, and we actually think we've got a really good place where we can start getting this moving forward. As a model that's customized to Indiana and Indiana localities, and most importantly, that has the right services and supports in mind for those very young children when they enter into the CHIMS case system. So we'd say our partners on that are the Villages of Indiana, who has a grant to support the coordination of this whole effort. DCS, we've got discussions going on with them as well. The Supreme Court strongly at the table, and we've of course re-engaged with the legislators to say, here's what we're doing. So let us know if we're staying true to what the intentions are, as there might be need for additional support or tweaks as we move through and we build that out. But very happy to say it looks like we've got some positive momentum right now. So it's in that kind of researching and building our model phase. But we're looking at early fall already getting some training opportunities going. We have some groups from the courts and from the villages and others. They'll be going out to Boston for some pretty intensive training. Hopefully we'll get a judge or two to go out there with us. And then looking at hopefully getting something close to implementation by the end of this year. So very excited to see that. Bernice?
Developing the pilot.
Yes, but thanks for mentioning that. There is a statewide advisory team that does have defense attorneys as well as prosecutors and some of the other folks attached to that. And as most of you know me well enough to say, if there's a missing piece there, we're gonna be bugging you to say we need to have you at this table too. And these cases are ones that there can be a wide range of people that are appropriate. So of course, service providers like First Steps, making sure we have our community mental health centers attached to it and involved there. All of those different entities, because we want to make it ideally something that's more of a playbook that would get the courts to saying, here are services and sports we know are available to you, and here's how to engage them when you have that 0 to 3 case and make them a part of that team from the start.
So explain kind of having a 0 to 3 overlay over a host of different types of cases. Is that right? So, well, let me pause. Is that correct?
Yeah, specifically looking at Chin's cases is what it would say in code for where it is at. It would allow for informal adjustments as well, which is a gray area. Mm-hmm.
When I heard it, I didn't know if it meant all types of cases, like including criminal. That's what
Yeah, and that's part of why we're piloting too, because we want to see what comes next with that. Big question on this one has been also, well, how does concurrent planning come into play on this? Are all cases of all different types going to be appropriate for this kind of court when there's certain kinds of contention or other things going on? So that's another reason we said, well, let's instead of just taking a model that's working in another state and throwing it into Indiana, let's figure out what Indiana's model should be based on the lessons learned by all these other jurisdictions that are doing it. Cool. So just an update on that, but of course I'll bring back if there's a need that we need to do something more specifically. Right now we're, as the commission usually does, we're kind of playing that matchmaker role of making sure that we take some roadblocks out of the way and get the right folks connected and working together on it. But obviously this is an area of child welfare that is very close to the work that we do on the commission, and hopefully a place where we can find some really solid success too. It's also a model that's based on partnering a little bit better with the parents and other caregivers involved in these cases and building better relationships there. So I can say we have a lot of groups pretty excited about if we get this going right, what it could mean and what it could model for the future. But again, it's very early, so we're going to try to do it carefully and do it the right way so we can grow something out of it that's very meaningful for the state. All right. Next, I just had a quick update on the Youth Justice Oversight Committee. So we've been talking about how that's getting integrated in with the CISC and what that looks like. So I think we've got a place where we've landed the different work groups that are under the Youth Justice Oversight Committee, kind of what the lay of the land looks like there. So they had many. Some had kind of completed their work. Others had work left to do that were a good fit for the Children's Commission. And others still said, we want to keep this specifically under youth justice silo, and then it gets presented to the commission if we have recommendations, things going further. So I can say under the Youth Justice Oversight Committee right now, it looks like its subgroups will be its grants work group, which is making sure that those Youth Justice Oversight Committee grants are getting the right support and structures and ideas behind them from some of the juvenile justice stakeholders. Also their data group, which is working on some very specific data case study related items and looking at case flows, looking at outcomes specific to juvenile justice, and their behavioral health group, which we do have a behavioral health group under the CISC, but as we really looked at this, it was more about making sure that we had services mapped out and understood by the judiciary, that they had access to them, that we had the right connections with experts, that where to refer to and how to refer at the right time, knowing where the open beds were and everything is a very big item that keeps a lot of judges up at night. And they've got to make those decisions for the cases, sometimes in short order in their courts. So the idea that we wanted to keep behavioral health related to juvenile justice very specific I think made a lot of sense the more we talked about it. So that will remain a group there. When it makes sense for it to be talking back and forth with our mental health and substance use task force under the SISC. So of course, we're going to keep that dialogue stream going. So those are the three that are continuing. We folded in a lot of the work related to things like diversion and transitional services into other SISC committees. So those will continue under the SISC. Some things that will be a little bit more ad hoc is reviewing things like the probation standards and some of the screening and assessment tools. Those are things that always come back for review every couple of years, I think, where there's things we need to look at and poke at them, but it didn't make sense to say, let's just have everybody keep meeting for the sake of meeting on an ongoing basis. So those will be more of an ad hoc role. And that constitutes the bulk of the work that's under the Youth Justice Oversight Committee there. So I think we can say that we've gone pretty close to completing all that transitional work. Judge Kenworthy chairs that, so you can always reach out to her on any more of the items on that. But I think we've gotten a little bit smoother flowing and got a better understanding where everything layers into that org chart. Then last, but definitely not least, we have some staffing updates for the Children's Commission. So I think I've noted before that Blaine Cook, who's been with us for 4 years, is planning on moving to South Carolina. So we can hate that he's moving. We can also hate that he's moving to much likely better weather and beaches and everything else. But been with us for a long time. So just a few important things Blaine's been involved with, really leading our efforts on youth engagement from the start. Back when he was an intern with us, he's played a huge part of that, presented numerous times. Some of you have been here long enough to know nervous intern Blaine having to present up front of the commission and do all that when Julie was here and making him get up there and do all those things. So, so much work on that. Also, the work he's taken on with his role as coordinator with us, increasing just retention and support for our task forces has been huge. They're able to function much more smoothly, get things moving and flowing along, getting recommendations out the door. That we had a lot that I think when we didn't have that role needed a lot of nudging very regularly and probably not as regularly as should have been done or could have been done when we didn't have his coordinator position in. But the amount that they feel encouraged and strengthened by that work under our last strategic plan, where he helped lead that we were going to start with their voices and then feed up to the commission. All those different things are things he really shepherded. Go for our data day too. I did pull up some data on his 4 years of service. So he has had to tolerate over 40 commission members, dealt with over 400 volunteers on our different committees, task forces, and work groups, leading to dozens of recommendations that come through those entities. He sat through over 500 meetings. It's a lot of meetings. And several thousand instances of resending information that he's really sure he's already sent to that person many times before. On a more personal level, I've been tracking since I started working with him important aspects of his work with me supervising him. So of the 24,000 plus dad jokes he's had to deal with, I have gotten, of that 24,000, over 24 smiles, 6 laughs, 20,000 instances of shaking his head in disdain and disapproval, 2,000 times of telling others to not encourage me when he saw them laughing or smiling, and 2,000 apparently he just didn't hear because they were really funny and he completely ignored them. So I don't think I missed anything, but obviously he's been a great asset to us and really stands for what the commission is all about. So we'll be missing him greatly.
Can we have him come up to the podium? Blaine, we're gonna miss you.
Yeah, I miss you guys too.
But, we're excited for you and your new adventure. So what has the commission meant to you?
Commission's been a lot. I think when we've been talking the last few weeks, the thing I'm most appreciative is just how much I was able to learn. I was still in school while I started as an intern, and then these couple of years post-grad, I was able to learn so much about so many different things that I never would have thought that I would have been able to learn about. So how broad and how wide the commission's work is and the different areas we have for impact and opportunity for impact, and was something really cool. So I will always be, keeping track of what you all are doing and paying attention to Indiana. So I'm appreciative for the time I've had, for sure.
What's your future plans?
None yet. I'm taking my sweet time trying to find my next job. So no, I got to get there and settled, and then I'll start to look around. I'll be doing something similar, I'm sure. So
Good.
Yeah.
Any questions, comments for Blaine?
Thank you, Blaine, for encouraging me to apply for this position.
Absolutely, of course. Thanks for doing so.
I have one. So the fruits of your labor, you will never know what you've brought to this commission. You will never know the magnitude and the volume of how you've blessed us all and blessed the children of the state of Indiana.
Thank you. That means a lot. Thanks. Appreciate you.
We can't end with just this. So we have Blaine's replacement. So I don't know if Allie, if we can get Allie to come up and introduce herself. I know we know her, but I think it would be great for her to come up.
Yeah. I don't know. Keeping in mind that this is all Representative Devon's fault because I told them that I would not ambush them up at friends. But we're very, very fortunate. So with Blaine leaving leaves a huge gap. And again, every sentence that Blaine says usually ends with, let me know how I can help, right? So true servant leader. And I think we've all experienced that firsthand. So we had quite a search to make of finding somebody who could step into those shoes. But we were elated to have a lot of very, very strong candidates apply for his position. Final selection was very, very difficult, but I'm pleased to say we have Ellie Leonard, who some of you may know. Ellie has experience with just about every program out there that relates to our work. She's worked through Annie Casey, Foster Success, the Forum for Youth Investment on our team there. She's done nonprofit management work for several years, most recently with DOE. Sorry, we stole her. And of course, served as a past commission member for 2 years, which is really cool because she was my boss and now I get to tell her what to do. But thrilled to have her joining us and coming on board. And yes, Ellie, if you would like to say a couple of words. So about as positive as we can make the transition. So Ellie's going to be a great asset to our team and we're super happy to have her on board. She's been with us for just a little bit over a week so far, but she knows us. She knows which ones of us to avoid. She knows which ones are safe to engage with, and she's learning very, very quickly. We're happy that she's been able to overlap with Blaine a little bit too on all the fun tech support and background pieces that go on. And that's me. So next meeting date. So again, be prepared at the next one for some of that legislative engagement work. We'll also probably have our annual report. You have last year's up front of you. If you have any thoughts or suggestions for next year's, get those to us soon. So we can help write that narrative, especially if we're going to make some pitches legislatively in the next year. The annual report's a good place to really tell our story as we're building that out forward.
That being said, I just want to make a comment that this commission that it's important that we work together. It's important that we help each other succeed. We look at these numbers, we get excited because we're improving, but there's still a lot of children in this state that aren't succeeding. They're failing, dropping through the cracks. Those are the ones that we got to fight. So let's just pray for one another and just keep fighting. And if you need help or direction or assistance, need somebody to talk to, reach out to somebody. You got to be the next group of kids that are coming along need our help. So thank you for all your efforts. I really appreciate it. So with that, we're adjourned.